Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for, and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit. And don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. Today we're going to be talking about everything you need to know about your teeth and diabetes. We all enjoy our food and we have to chew a lot of the food we eat before we can swallow it. So it's really important for us to understand the connection between our teeth, diabetes, and our health, and what we can do to make sure our teeth and gums are healthy. Today, I'm going to be talking about this with a very special person. I will not let the cat out of the bag myself. I'll allow her to introduce herself and then we'll take it from there. So over to you.
Good evening, everyone, and good evening, Dr. Barbara. Thank you so much for having me. My name is Kehinde Oshinaike. I'm a consultant family dentist. I work with the Lagos State government, specifically General Hospital Ikorodu. I'm the head of department of the dental clinic there. I'm married to a pediatrician and I have two beautiful boys. Thank you.
Wow. Welcome. That's quite interesting. Pediatrics and dental care. Okay. So why are the teeth special? What makes them? You must have found them special to do dentistry. Why are they?
Okay, so one of them is the beautiful smile that you have on your face, Dr. Barbara. That's one of the reasons why our teeth are special. Because without teeth, we would not look as nice as we do. And so that's why it's very important that we take care of our teeth. That's number one. Number two is that without our teeth, we will not be able to swallow our food because our teeth are needed to chew our food into little bits to make it easier for us to swallow. And three, our teeth are part of a special part of our body, which is the mouth. And two things we always say in dentistry, that your mouth is the gateway to your body and your mouth is the mirror of your body. So your mouth plays two roles, is the gateway and is also the mirror. Why do I say your mouth is the gateway to your body? Everything that you consume goes through your mouth. Everything, that's the way God made it, for you to for food to go through your mouth, water, everything to go through your mouth. And two, your mouth is the mirror of your body. the things that are happening in your body, they are easy to pick up from your mouth. So sometimes we have patients that come to the clinic and they're complaining of, say, let me say ulcers. They have a recurrent ulcer, they have ulcers now and again. And you examine them and you ask one or two questions and you find out that some of them are under stress. You find out that some of them, you find out that some of them have, they have all sorts of things that are going on in their body. And we pick that up just from the mouth. And since we're talking about diabetes, we have patients that come into the clinic complaining of loose teeth. Their teeth are shaking for no reason. They just find out that their teeth begin to shake. And they find out that the teeth that were in the center of the mouth before have moved away from the center. And so we tell them, okay, let's go for some tests. And it's not just one tooth. Once you have it generalized, so we tell them, go for a test. And more than 95% of the cases that come to the clinic, you find out that they are diabetic.
I see. That's interesting.
Yes.
I'm trying to imagine how teeth can move. And
yes, teeth do move. It's called drifting. Yes.
Wow, I see. Okay, you talked about ulcers. Is it peptic? Is it the same as peptic ulcer, or it's what do you mean by ulcers that you see patients with?
Okay, so we have what we call recurrent ulcers. So they have, for layman language, they have wounds. They have wounds on their gum.
Okay.
And so that's why you find some people, they will say, oh, I can't eat peppery food because so it's almost like the peptic ulcer, but this time you're having it in the mouth.
In the mouth, I see.
Yes, and it's a sign of, stress. It's a sign of deficiency in one or two of iron deficiency and stuff like that.
Yes.
So, yes. Okay. So that's what I mean when I talk about the ulcers. And so the patients do not know, they just come and they're complaining of ulcers. And when we check, you find out that they have one or two things happening in their body.
Okay, great. So what about gums? What is the function of the gums? Is it just to hold the teeth?
Okay, amazing. Yes, the gums, aside of holding the teeth in place, they also protect the teeth. And so as part of, the anatomy, you have your tooth structure. You have the part that you can see on top, which is you have your enamel and your dentine. And then the part that you cannot see, which is the one below the gum, which is your root, the root of the tooth. Yes. And so what demarcates that place is your gum. And so when your gum is diseased, it's going to affect the tooth because there's supposed to be a close adaptation between your tooth and your gum. So if the gum is diseased, it's going to affect the tooth. So the gum is not just, it's not just for beauty. It's also for protection and preservation of the tooth.
Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. What you say just is amazing. The teeth look like they are so strong, and then what is protecting the teeth is something that is softer, or it's
exactly.
you think it will be the other way around, that is the teeth that are protecting the gum, but it's the gum that are protecting the teeth, and they are protecting the root of the teeth, the part that we cannot see.
Exactly.
Wow. Okay, so
when your gums are diseased, for example, people that when they're brushing, they bleed. That is telling you that your gums are diseased. And so that's what we call gingivitis. You have bleeding gums. And if that process progresses, it affects the deeper structures of your tooth. And that's why you were asking that you wonder how teeth can move. And so the deeper structures of the tooth, once they are affected, that is the ligaments. Those are the things that hold your tooth to your bone. Yes. Once that disease process goes below that aspect, then you find out that teeth begin to wobble. And once they begin to wobble, they begin to move.
Once they begin to wobble, it means there's trouble.
Exactly. There's trouble. Once they begin to bleed and they begin to wobble, there's trouble.
Yes. Okay. So, what makes people lose their teeth? You've just explained if the gums are diseased. What else can make people lose their teeth?
What else can make people lose their tooth? If you don't take care of your teeth, you will lose anything you don't take care of, you will lose.
Okay, so that brings me to the next question. How can we take proper care of our teeth and gums so that we don't lose them? Because we don't want to lose them.
That is an amazing question, and I'm glad you asked that question. Number one, how do you take care of your teeth? The first thing, you need to brush twice a day. Twice a day, morning and last thing at night. And you need to use a fluoride-containing toothpaste.
So we can't use chewing stick?
So yes, people do use chewing stick, and it is good for you to use chewing stick. But some people don't chew the bristles of they don't chew it long enough for it to be soft. And so rather than the chewing stick being an advantage, it becomes a disadvantage. So chewing stick is good, but you need to make sure that the bristles, you chew them until they're soft enough so that they don't damage your gums. So you can use chewing stick. That's number one. That's number two. You need to use your fluoride-containing toothpaste. Any toothpaste that contains fluoride. So you need to check on the label and find out that whatever you are using, the toothpaste you are using has fluoride, contains fluoride, because the fluoride content that is in your toothpaste actually strengthens your teeth. Number three, you need to floss after your meals. You need to use a floss. So I have a floss here. I'm going to just lift it up.
Okay. Can you?
I hope you can see it.
Yes, I can see it. Yes.
Good. Now, when you are using your dental floss, many people use this part of their floss, which is the sharp part. When you use the sharp part, you are damaging your gums. You are damaging, remember I spoke about the ligaments that hold your teeth to the bone. You are damaging those ligaments. So what you should actually use is this side, which is the thread part of your dental floss. So you need to floss after every meal. What does the dental floss do? You have things that are stuck in between your teeth. So when you use your dental floss, it helps you pick out the food and the food particles that are stuck in between your teeth. We do not advocate for us to use toothpick, because toothpick actually does damage the tooth structure. And this part is likened to the toothpick. So we don't advise you to use this part, but we advise you to use the thread part of your dental floss. Some of them actually just come in strings. I don't have that one with me, but it comes as a string. Yes. So you can use that as well. Another thing is for you to visit your dentist. I've advised you to visit your dentist every 6 months. But for some people who their oral hygiene is not very good, or they are prone to dental issues, we actually advise them to visit their dentist less than 6 months, maybe every 4 months. So you visit your dentist 3 times a year or twice a year. And what do you visit your dentist for? Scaling and polishing. You need to come for scaling and polishing, which is professional tooth washing. Because no matter how good or how expensive your toothbrush is, there are some places that your toothbrush will not be able to reach. And so we advise you to visit the dentist so that you can have your professional cleaning. And also for your dentist to look into your mouth and see, so that whatever is in your mouth your dentist can catch it fast. And then also, we also advise you, of course, your diet. Your diet is important in taking care of your teeth. We advise you to take lots of fruits, avoid sticky foods, because when you have sticky foods, they stick to the surfaces of your teeth. And if you don't brush, then it's going to cause issues. So those are the things that we advise you to do. Take lots of crunchy fruits, crunchy things like carrots, things like apples. They help you for your teeth.
Wow. So I'll just try and go over everything you've said. So number one you said is that we need to take care of our teeth by brushing twice a day with toothpaste that contains fluoride.
Yes.
And then we can use a chewing stick, but you must chew it so that it is soft enough that it doesn't damage the gums.
Yes.
Then we should use a dental floss after every meal, especially for people like me that have gaps between their teeth and then pieces of food get stuck in between. Yes. It is harmful to use a toothpick, so we should avoid using toothpicks.
Yes.
And then we should eat healthy meals because we get the nutrients that our teeth and our gums require from our meals. And then chewing is good for the teeth. It's like if you don't exercise your muscles, you become, what you don't use becomes not healthy or not strong. So to keep our teeth strong, we need to eat crunchy foods that will help us exercise our teeth. And then we should avoid sticky foods because they stick to the teeth.
Yes.
So diabetic patient, and then we should visit our dentist at least twice a year.
Yes, twice a year. At least twice a year.
Yes. But if we have issues or problems, we need to visit more often.
Yes.
Yes. Okay. So diabetics need to follow all these guidelines that you've said. But are there any other special precautions or special things that they need to do because they are diabetic?
Yes. Because they are diabetic, they are more prone to infections. They are more prone to gum disease. They are prone to periodontal disease, which is, I told you, when the disease goes, has progressed. So they are more prone to all these things. And so we advise them to visit us more often than twice a year for general cleaning. And as well, they also need to brush at home. They need to brush, after every meal, if they can rinse out so that they don't have food that are stuck in between, in between their teeth. They also need to eat healthy. And of course, for diabetics, they need to ensure that they are taking their drugs regularly. Because once they don't take their drugs regularly, it will show in the mouth that they are not taking their drugs regularly. So they need to take their drugs regularly. And because you also know that in old age, once people begin to get older, the salivary flow begins to reduce.
Okay.
It begins to reduce. And some of the drugs that the elderly people also use also reduces salivary flow. And what does saliva do? Saliva helps us to wash away all the food debris in our mouth. And because they have reduction in the salivary flow, you find out that they are more prone to dental caries. What is dental caries? You have holes in your teeth. So they are more prone to things like that. And once dental caries progress, it progresses to so many other things. And so they need to be more careful and they need to be more deliberate about visiting the dentist.
Okay. So I'm going to ask about the foods, things that they can do to exercise their teeth now, because I just thought about it. So chewing gum is not good because it sticks to the teeth and it's sweet. What about people who say they are chewing gum?
Okay, so they can chew gum. They can actually chew gum.
Okay. Any kind of gum?
They can actually chew gum, but sugar-free gum.
Okay.
Sugar-free gum. So what does the gum do? You find out that when you chew gum, you find out that it increases salivary flow in your mouth. So you can't chew gum, but ensure it is sugar-free gum. And that's why you find people that are chewing gum, you find out that they have a lot of salivary flow. And it is actually good. Salivary flow is very good in your mouth. So what I meant by sticky foods was like things like very soft plantain. Some people love very soft plantain. And because if you look at the surfaces of your teeth, if you look at the surfaces of your teeth, the surfaces of your teeth are actually rough. They're not smooth.
Yes.
And so when you eat those sticky foods, like your very soft plantain, it sticks to the surfaces of your teeth. And so once it sticks to the surfaces, and then you don't brush, what happens? Remember that we have bacteria in our mouth.
Yes.
And what do the bacteria thrive on? They thrive on food that you have left over in your mouth.
Yeah, yeah.
And once they consume that, what do they produce? They produce acids. And what did acids do? The acids destroy your teeth. Yes. So when you eat those soft plantain, so we say eat things like carrots, eat things like apples. What do? Because they are crunchy, they can help to, rid you of all those things that are on the surfaces of your teeth.
Okay.
And so that's why when you eat all these things, we tell you last thing at night, try and brush.
Okay. What of kola nuts? A lot of
kola nuts is okay, it's crunchy.
Okay. All right. So they can eat kola nuts.
Yes, we can eat kola nuts. It's just that some kola nuts, some of these things stay in our teeth.
Okay. Okay.
Yeah.
All right. So how can family members help diabetic patients with regards to teeth care?
Family members with, first of all, they need to encourage their parents or whoever it is that has diabetes to brush regularly, take their drugs. And another way they can encourage them is to also bring them to the clinic regularly. So that is the way that family members can help, and also discourage them from taking things that would increase their blood sugar level. Yes. So discourage them. You know that most of these diabetics, some of them can be stubborn. They'll say they want to eat this, they want to eat that. So that's where family members come in. You need to help them. It's all a collective work, because what the dentist cannot do for you at home is what the family members would do. The dentist can only do what they can do in the clinic, but the family members now take over
at
home to make sure that they do all these things, make sure that they brush, make sure that they rinse out, make sure that they use dental floss, all these things. So that's how family members come in. So family members are actually very, very important in the care of the teeth of diabetic patients.
Thank you for that. So the next question is, supposing a patient has lost their teeth and they are wearing a denture, how do they need to take care of this? Because the denture actually rests on the gum. And
yes.
From what you've said, we need to protect. I feel like we need to protect the gum.
Yes.
So what precautions, what care should they take if they are using a denture?
So if they're using a denture, first of all, nobody is going to put a denture on an unhealthy gum.
Okay.
So even when patients come to the clinic and they're insisting, if your denture is not, if your gums or if your mouth is not healthy, nobody's going to put a denture. Because what happens when you put a denture, as you said, the denture is going to rest on the gum. And if the gum is not healthy, that denture is putting pressure on that gum. Remember that denture, you are going to use it to chew.
Mm-hmm.
And so as you are chewing with that denture, it's transferring pressure onto the gum. And so if that gum is unhealthy, it's going to cause further damage to that gum. It's going to cause further damage to the adjacent teeth. And so before dentures are placed, the gums have to be healthy. You need to take care of that aspect, even though, yes, we know that their teeth have been lost and they want to, so they need to take care of that aspect first. Now, if a patient is wearing a denture, they need to clean the denture. We have patients that they've been wearing their denture for years. They don't clean the denture. They don't remove the denture. So we advise patients that wear dentures, you need to get a small cup with water, clean water in it. The cup must have a cover. And so at night before you sleep, you put your denture in that cup. And when you wake up in the morning, you take it out and you have a soft brush that is specifically for your denture. And you use a toilet soap, not medicated soap. Remember that your dentures are made with chemicals. And so you need a soft brush. Yes, you need a soft brush to wash the outer part and the inner part of your denture. We advise patients not to sleep with their denture because we've had situations where patients sleep with their denture and by mistake, they swallow the denture. So we advise, yes, especially when the denture is small. So we advise you remove your denture at night. In the morning, you take out your denture. After you've brushed your natural teeth, you take your brush for your denture and you brush every part of your denture. And then you place it back.
So I just want
how to care.
I just want to go over that. So anyone that has a denture has to have a toothbrush for the denture and a different toothbrush for their teeth. They can't use the same toothbrush for both. And they use toothpaste for their teeth and soap for the denture.
Yes, toilet soap.
Toilet soap. Okay.
Not medicated soap.
Not medicated soap. Okay.
Yes.
And not detergent.
No, not detergent. Toilet soap, yes.
Toilet soap. Wow.
Yes.
Okay, and they need to clean the denture every morning before they put it into their mouth?
Yes. It's just like brushing your teeth every morning. It's just that these are your artificial teeth, yes. And at night you put it in a cup that has just ordinary water, but the cup must have a cover. And of course, you must change that water every time, every day. You must change the water every day, yes.
I'm just thinking about water, the importance of water.
Yes, water is very important.
Yeah,
so many things, yes.
Okay, so if I have a family member that has diabetes and uses a denture, what do I need to know? Are there things I need to do in case the diabetic falls ill? And, like sometimes diabetic patients become unconscious. What should we do about the denture in that case? When the patient has to go for surgery or the patient has to be admitted, what are the things that we need to know to do in such an instance? Because from what you've said, the patient should not fall asleep with the denture in their mouth.
Yes. But some patients, they are very good at sleeping. They've become, they've adapted to the use of the denture. And some of them actually sleep with their denture. They sleep with their denture. But as I said, the smaller the denture is, you have some patients that have just a one-tooth denture and it's so tiny. And so we advise those patients, don't sleep with your denture. Remove your denture so that you do not swallow your denture. And so also it is, the patient is going for surgery. Remember, especially if it's surgery under general anesthesia, they're going to intubate that patient. So that denture must be removed. The patient has become unconscious, that denture must be removed.
Okay.
All right, just to avoid that they swallow the denture.
Okay, so family members need to inform the medical personnel that the patient has a denture, or they remove it themselves?
Oh, they have to. I'm sure the medical personnel, of course, by the time you are going to go to surgery, I'm sure they would see, but it's good for the family members to tell the medical personnel that, this person has a denture. And of course, once they have a denture, the anesthetist would not intubate with a denture in situ. Yes.
So we've come to the last question. What advice do you have for diabetic patients and their family members? One piece of advice.
My advice for diabetic patients, visit your dentist very often. Visit us very often because we want you to have those teeth in your mouth for as long as possible. We want you to keep on smiling. We want you to keep on having that beautiful face. And so visit us for your scaling and polishing. Visit us for advice. Visit us so that if there is anything happening in your mouth, we can detect it on time. So family members should ensure that the diabetic patients don't run away from the dentist. Actually, the dentist is actually their friend. So we advise you to see us more often so that we can catch those things on time and so that you can have your beautiful smile for as long as possible.
Thank you so much, Kenny. You've heard it all. The dentist is your friend. It's not only the police that is your friend. The dentist also is your friend. So visit them at least 3 times a year. If you need to see them more often, I'm sure they are happy to see you. And brush your teeth morning and evening. Eat healthy, eat crunchy foods, and use dental floss. I think those are the takeaways, the key takeaways. If you have a denture, always tell whoever is taking care of you so that they know what to do. Thank you once again, Dr. Kenny, and thanks to
Thank you so much, Dr. Barbara.
Thanks to everybody listening. See you again soon. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soil.web.app. Download it now. See you in the next video. Bye.